Hi, this is Kareen with Kareen & Company. That's K-A-R-R-E-N. Today we're going to talk about fire cupping. I am a licensed acupuncturist and a licensed massage therapist. So my purpose today would be to reduce some of the connective tissue and the hypertonicity in the upper mid-back, to reduce some neck ache and some discomfort in the low back. So we're going to start with fire cupping. And 100% cotton balls are the best. 70% alcohol. This is definitely something you do not want to be home if you are not a licensed practitioner. This is strictly for therapeutic purposes on a client coming in for relief of pain. So what it does is it creates a section. If you want to come just a little closer, you can see how the skin pulls up underneath. I'm going to use a larger cup to really pull those rhomboids, that discomfort. I'm going to put one here, which is a nice point to use for releasing the rhomboids, the trapezius. So, as you can see, if you come get a side shot, this is probably medium to strong cupping because it has a tight pull in there. It definitely is because she has stagnation, and the tighter my cups are, the more it pulls the chi up and the blood and gets the blood moving between the muscles and the tissues. I'm going to take them off again, and I'm going to place them on there one more time. And these have only been on just a couple moments, and you can see areas where there's a little more stagnation. If a person didn't have any disharmony in their muscle and their tissue, there would absolutely be no residue of having cupping done. So the more discomfort, the more pain you have in your muscles, the more stagnation you'll see. So I'm going to do a light cupping. A light cupping is just very light. And with a light cupping, we have oil. You want to be able to slide and glide. But as you see, that's a little too tight on the skin. I don't want to tear the skin. I don't want to create any disharmony. So I'm going to put a little more oil. And then you see this is sliding cupping. And what this does, here's my spine. So I'm staying off my spine. What I'm doing is I'm working the rhomboids. This is the middle trapezius, this is the lower, this is the upper. How does that feel? Is that uncomfortable? Mm-hmm. Does it feel good? Mm-hmm. Okay, so when a person has a lot of tightness, they don't mind having this sliding cupping. You just have to make sure they have plenty of oil. You don't want to do anything that, like over here, it doesn't slide and glide as nice. I do have oil there, but the more oil I have on, the more my client will enjoy it. So we'll leave that there. Let's put a little oil on the opposite side. And let's see, I'm going to have to do a little trigger point therapy in this area here because she is so tight. But all I'm doing really before I do that is I'm just loosening up this tissue. I'm getting a lot of chi and blood in there. I'm creating a lot of connective tissue where it gets a little more blood flow, which reduces the pain, which reduces or enhances the range of motion. And I don't mind going over the spine from the cervicals down the thoracic. You can take it all the way to the lumbar. As long as you're not hard on it, our Wato Jajis, right beside the spinal area, and it's really good in Chinese medicine to really work that tissue. I can feel these knots over here. Again, this is sliding cupping. You want to be really gentle on your client. You don't want to hurt them if they say, this is hurting, that's painful. Make sure your cups, make sure the ridges of your cups have no chips in them. This treatment should be so relaxing for them. They should feel really amazing. How does this feel for you?
Feels excellent.
Does it hurt?
No.
Okay. Sometimes people say it does hurt, but then I ask, is it a good hurt? Because sometimes it's like you could be so tight in your muscles and it's like, oh, it's such a good feeling. So I probably would do this a good 5 minutes on each side. And again, this is cupping, fire cupping. Thank you. Please like my page and subscribe.